Okay, 45-year-old man, unresponsive. He's got 97.7. Blood pressure is 110 over 65. Respiratory rate is 6 per minute. Whoa. Arterial blood gas shows some low PO2, some high CO2, and alveolar oxygen at 63. And the gradient is normal. Interesting. Okay. So, which is going to be the cause of the patient's hypoxemia? Just take a second, try to answer this. Okay. So the key findings here are going to be 6 breaths per minute. That's pretty low. And also the CO2 is pretty high, so you're not breathing out as much CO2 as you need. But the gradient is normal. Okay, the gradient would not be normal in different conditions. The gradient would be high. And if there was a shunt, like pneumonia or fluid in the lungs, or if there were a pulmonary embolism, it would still be high due to the low perfusion. So ventilation and perfusion mismatches cause differences in the gradient. Here we see a gradient that's matched, and there's slight decrease in, let's say, the ventilation. But yeah, this dude, what's going on? So diffusion impairment. So if you can't diffuse, then the alpha gradient would be high because oxygen can't pass into the blood properly with the diffusion impairment. So the gradient would be high there. High altitude exposure, that would cause low oxygen, but normal CO2, not hypoventilation. So that would not make any sense because our CO2 would be at least normal. Pulmonary embolisms. Okay, pulmonary embolisms. Lungs can get air, but they can't get blood. So that would mean the gradient would be really high, right? And pneumonia, that's a VQ mismatch. Some areas of the lungs would be blocked, and so you couldn't ventilate. And so then it would be high as well. You'd have that high gradient. So the gradient is normal, and that tells us that this dude has some CNS depression, and usually that can be due to like an opioid overdose. So that's going to be our answer to this question. It's going to be C, hypoventilation due to respiratory depression, because there are some drugs which can definitely cause respiratory depression. Opioid overdose is definitely one of them, and yeah, that's pretty much all you need to know to answer this question. So if it was helpful, go ahead and like and subscribe.